please, as a reminder, please put your phone on mute if you are not speaking. We are recording this, so it will go up to our YouTube page this afternoon if someone missed it or you need to share the information with anyone. So let's go ahead and get started with a quick roll call. We'll start with our hospitals. So we'll start out at Anderson Hospital. Going once, going twice for Anderson Hospital. Eric, are you on? Not yet? Okay. Alton Memorial. Boyd.
Nancy Willemweber.
Hey, Nancy. Glad to hear you. In 2021, it's going to be a great year. Carlinville Area Hospital. Staunton.
This is Sue. I'm here.
Hey, Sue. It's 2021. Let's go. Fayette County Hospital. No Tina today? Okay. Gateway. Gateway Regional. Either Rick or Danielle. Nope. Holy Family.
Hi, this is Ashley and Jeremy. We're both here.
Gotcha. St. E's. Going once, twice. St. E's. Breeze. St. Joseph's Breeze. St. Joseph Highland. Jersey. For here at Belleville, you got myself, Scott Klosterman, Lee is on, and for East, over Memorial Hospital in Shiloh. I don't know if Eric is on right now. I'm trying to scour. So Eric, if you are on, you can sound off. Memorial Hospital in Chester.
I'm here. It's Georgia.
Hey, Georgia. I think we got Gary on from St. Anthony's.
Gary's here.
Gotcha. Redbud.
Diane and Tara are here.
Hey, Diane and Tara. Sparta Community Hospital.
This is Dale. I'm here.
Oh, gotcha, Dale. Thank you. Touche. And we got Amy, right?
Yes, good morning. Happy New Year.
Happy New Year to you too, Amy. Amy Frantic. Let's move over to our health departments. Bond County. Calhoun County.
Calhoun County's here.
And who is that speaking?
This is Megan Eilerman.
Gotcha, Megan. Thank you. Clinton. Clinton County Health Department. Eastside Health District. Fayette. Greene County. Jersey County.
I guess on mute.
Macoupin County.
Macoupin's here.
Who's online?
It's Derek.
Gotcha, Derek. Thank you very much. Madison County. No Michelle today? What? Who gave her a day off? She'll probably say, I'm here. Monroe County.
Vicky here.
Gotcha, Vicky. Randolph County. And St. Clair County.
This is Sam. I'm here for St. Clair County.
Gotcha, Sam.
This Bond is here.
Gotcha, Terry. Bond County. Gotcha.
Hey, Phil. Just got a text from Eric Brandemeier. He won't be able to attend, and Deborah is on from Randolph.
Perfect. Thank you very much. Yep, I see Deborah in the chat now. Thank you.
Heidi from Jersey County's here.
Heidi, thank you very much. Jersey County.
Hey, Phil. Eric's here with me.
Oh, wow. Okay. Oh, you're talking about our Eric Perham. Gotcha. Perfect. Yep. And we got Mike Gilbert on from our Remert and here at Memorial. So great. Our RMSC, Greg, are you on?
I'm on, Phil.
Gotcha. Beth Busman, Emergency Response Coordinator, are you on? Any of our BJC partners? Any emergency management agency? Anyone from MedStar Ambulance?
Good morning, Phil and everyone. It's John.
Hey, John. Good morning. Happy New Year.
And Chuck.
And Chuck. Happy New Year. All right. SLU? One more opportunity for SLU. Nope. Scott Air Force Base. And last but not least, STARS. Okay. Oh, Dale, gotcha. Thank you, Dale. I see you right there. There was somebody else.
Phil, Dan from Sparta just jumped on too.
Sparta, perfectly. Gotcha, Dan. Thank you very much. Anyone I did not call would like to just be recorded for attendance?
Leslie Schmidt from Abbott EMS is on.
Thank you, Leslie. I'm going to make sure I put, this is the second time. I forgot to put it on there this time, but I will make sure I have you on our community partners list. My apologies. Thank you.
Renee Cruzy from St. Joseph's Breeze is on.
Gotcha, Renee. Thank you very much.
Rick Wolf at Gateway is on.
Gotcha, Rick. Thank you. I called you out by name too. I was like, I didn't get no Rick when I went past Gateway. Okay. I see.
I had to come back in.
I said, I see how you want to be in 2021. Okay. No, I'm just joking. Great. Glad to have you.
Molly Peters from Greene County here.
Molly, thank you very much.
Sherry Heats is on from Illinois Primary Healthcare Association.
I'm sorry, who was that again? You had somebody, there were two people talking. Ma'am, go ahead.
Sherry Hoots from the Illinois Primary Healthcare Association. Generally, Paula Campbell attends these, but I'm attending on her behalf today.
Yes, thank you, Sherry. And there was someone behind that was speaking same time. Gentlemen.
Jeremy with Mosquito.
Gotcha, Jeremy. Thank you.
Hey, Phil, Marty from Region 5 RHCC.
Who? Way to go, Marty.
Marty, Region 5 RHCC.
Yep, indeed. Gotcha. Thank you so much.
Hey, Phil, Brian Lightkey from Alt Memorial covering for Ashley. He's on as well.
Perfect. Thank you. All right. And if anybody does join, didn't get a chance to shout off yet, just please go ahead and put in the chat or shoot myself and Lee an email, and we'll make sure that we got you. So, all right, we're going to go ahead and get started. Again, and Happy New Year to everyone. I'd like to thank you for making it through 2020, and we're going to be looking forward to 2021 going a little smoother. Not sure we're starting off on the right foot, but we're going to get us on the right foot, but we're going to get there. So, we're going to skip over the agenda. We're going to try to make this short and to the point today. We'll start off just with the region census and how it's looking as far as, inpatient census across the region. As you can see, slight downward trend, which is good. It's so odd. I look at the last time we showed these slides to see is when we were kind of at the peak, and to look at where we were at in April timeframe, and to look and see where we're at now. It's just kind of remarkable what the last year's brought. I know we've learned a lot. We'll continue to learn a lot, but obviously we're not out of it at any way, shape, or form. I think just recently we had our highest case count across the continental, I won't say not the continental United States, but just the United States in general. We just hit a record with hospitalizations, and from what I understand, over the last 6 months we have 8 times. So we're at 800%. Where we were 6 months ago in hospital census with COVID positives and PUIs. So we got some states out there that are doing very poorly, I'm not going to say with managing the patient care, but I'm saying in the status in which they are today. You look across over in California where they've got patients in office rooms, hallways, et cetera. Not where we want to be. I'm thankful that we're not in that position, even though we've had some very high censuses here across the St. Louis Metro East and throughout our entire region. We could be in a worse place. So I'm just thanking each and every one of you for pushing through where we're at and helping drive the numbers back down. You are all leaders in the community. You all are leading by example when you're out at whether you know it or not, whether you're out in the supermarket or you're at your day-to-day job, when you're showing appropriate PPE wear and you are taking care of patients. You are doing yeoman's work. So I applaud you and thank you for everything that you're doing. Again, this curve is just emblematic of the amount of work that you're doing. And as that curve goes down, the work doesn't stop. It just changes. And I understand that. So we're a 24/7, 365 type of operation in healthcare. And I'd be remiss if I didn't say thank you for doing everything that you did in 2020. And I look forward to us continuing to do these things in 2021 and getting us in a better position. So if any one of you have suffered any loss to COVID, my condolences to you and your families. We're going to get through it together. So if you need anything, please let me know. Don't be shy. I will always say that. We're going to push this curve down, I promise you. Again, look at another kind of 25,000 foot view of the region and the state. We're currently, as of today, well, it's actually 2 days old, the 11th, we're 11.5% across the region for our positivity rate. ICU and med-surg availability still subpar, below the 20%. So that med-surg availability is still very shocking to me that we're only around 11.5%, or excuse me, 11.2% med-surg availability, and our ICU beds just hovered just below there, like 18.9%. We need to get above that 20%. And stay below that 12% to ensure that we can move back to tier 3 mitigations, which isn't that much different than tier 2, but it is a positive direction. So let's hope we can hang on to that, okay? And let's keep helping our health department partners out here drive those numbers down. So, all right, we'll start off with our general briefings from our partners. So we'll start with Greg. IDPH updates.
So I don't really have any updates. I do have a question as to, is there any plans regionally? I know that there have been some additional COVID-19 funds pushed out. And as you'll see, you have an email from Teresa this morning. So I'm just curious, what as a region are we planning to do with those additional COVID funds? Is there a plan?
So yeah, so we did. Okay, so in that, when we did get those extra funds, the 2 areas that we were investing, or 3 areas where we were investing funds with, were additional. They're not PAPRs, but different styles of PAPRs, for lack of a better term, for the region to use. Also, some ambulance or room disinfectant systems that are primarily, I would say we were looking at expanding to our ambulance crews, but to hospitals as well, to help relieve some of the stress and cleaning time for our EVS personnel so they could turn rooms quicker, at the tune of about $110,000 worth of those, as well as, what's the last? Hold on, let me look at my list. I have my list right behind me. I apologize. Lee, help me out because I'm looking at my list quickly. Oh, I'm sorry. And infrared camera systems. Now, so two issues with some of the extra money that we did get. So once we went down that road, at the timing in which we got the money, the supply chain was not there to support. So we kind of had to wait. Now that the supply chain is actually there, we're basically in a position where we have to reallocate the funds that we have in the grant. So, and what that means is that we have about another $111,000 that we do not have. And I guess I was going to talk about this during the grant update, but we have an additional $111,000 that we have to reallocate allocate in the extension that we do have, which came with that additional COVID money, that we're going to reapply to COVID operations in the form of ventilators. I think the number is either 7 or 9. Correct me if I'm wrong. Mike Gilbert, are you in there? Did you hear that?
So we are looking at 7 LTV 1200s and GoPax is what we're looking at.
To match what we were originally.
Phil, you're coming in badly broken.
How about now?
Better.
Okay. Yeah, I did. When you said that, there was a big purple pop-up on my screen that said that there was some connectivity issues. So hopefully you can hear me now. But we're going to take those 4 now projects after we do our realignment and have our GMO reallocate the funds so we can push forward and purchase those ventilators, the PAPR alternatives, as well as the disinfectant systems and infrared cameras. Now, we talked about this is what I was going to talk about later. We talked about the infrared camera systems and how we could use them. The original thought was to assist the local health departments and some hospitals with some of the vaccine clinics. Now we're good 6 weeks or 8 weeks into 6 weeks into vaccine, conducting vaccines. So that was one of the options I discussed, and we can discuss a little bit later. But those are the areas where we're looking to apply those COVID funds and I don't want to call it washout funds, but the realigned funds for things that we could not complete, like education and training that we did not do, decon classes, TNCC, ambulance strike team leader courses, all these courses all this money that we had in the budget for training and education that we could not use because we can't complete the classes because they're either no longer providing those classes or or you have folks that can't attend those classes because of their business policies at their organizations. So that's just a muddled mess there, but we're going to reallocate it to more ventilator supplies and more up-to-date vents. So we're going to sunset the impact ventilators that we do have, the disaster vents that we do have. We're going to allow them to die on the vine, so to speak, and not resupply those at all, and move forward with new ventilators and try to keep that as an update each year until we can fully account for the amount of ventilators that we'd be losing. And I think that's 30 ventilators that we had for the impacts. And we want to just replace all of those with the LTVs, something that we sent folks out for training for, that the EMS crews seem to like and can work in the hospital setting as well. That was a long bit of talking, so I apologize. But Greg, go ahead.
I apologize. I didn't mean to make you jump ahead. I just know, we're now to the middle of January, and I want to make sure that, we're keeping the eye on the ball of all those dollars to make sure that, we're getting them spent. Even though we know everybody is busy with everything else, we certainly don't want to lose those dollars, especially as we get the lessons learned through all of this and hopefully are identifying, areas where that money could be used the most. So I appreciate that. And once again, I apologize for making you jump ahead of your agenda.
No, totally not a problem. I appreciate you even asking and keeping us to task. I appreciate it. So I know Greg said he doesn't have any major updates, but any updates or any questions for Greg that you may have from IDPH perspective?
Hey, Greg, this is Rick Wolf. I know we talked, you did a survey for that, and I know I'm going to mess up. It was that high flow oxygen devices to see if the state would buy any of those. Was there any traction on that?
Well, here's what I found out. Literally the entire state needed them. I know that they have some of the high flow, so if you sent in, yeah, we'll take 3 of them, so did 200 other hospitals, which became an impossible task to follow. But if you have a need for them, you can request them through the normal resource request process. And what they do have, and I don't know what stock they have up there now, can be, gotten through the normal request process. I know they purchased some. There was no way they could purchase what everybody asked. So does that make sense what I'm saying? You can
Yes, sir. I appreciate
go
the
ahead and
update.
request them. Yeah, there are some, and you can request them through the normal process, Rick.
Okay, thank you, Greg.
Any other questions for Greg? Okay, well, thank you, Greg. We will move on. Dale, any updates, stars? Dale, if you are speaking, you are on mute.
No, sorry about that. A couple of other challenges there.
No problem.
No, nothing significant right now. Continuing to monitor hospitalizations across the state of Missouri. They remain high. Our partners, particularly on the western side of the state and the southwestern side of the state, are particularly concerned because the hospitals right across the border in Texas, Oklahoma, and Arkansas are reporting very full numbers as well. So we know that eventually sort of moves eastward, or at least that has throughout the past last year. So we're hoping that they can keep it on that side of the state, quite frankly. Otherwise, we are seeing some decreases in hospitalizations, but increases in positivity and slight increases in case counts in the state of Missouri. So we're watching that very cautiously. Otherwise, we are working. John Nowak on this call has worked with it a little bit, but we're working very diligently with our EMS on the Missouri side on some pieces that related to the potential. We hope not to the potential, but possibility of full ERs and things like that, and finding a way that hospitals can communicate that a little bit better than they have in the past, and that EMS uses it a bit better than they have in the past. So we're working on some details through that. So far, it seems to be moving forward. I know that sounds like a crazy thing because y'all have a different system over in Illinois that seems to operate pretty well. That has just not been established on this side of the line as well. So working through that, but seems to be going well. We continue to enjoy the partnership with y'all and all the communication. And from the vaccine point of view, it's getting there. Probably our biggest challenge is the fact that Missouri did not place EMS in Category 1A. However, we are aware throughout the state of EMS receiving vaccines. And that's not that they're jumping the line, it's just things happen. And so, it's causing some consternation on this side, particularly in the St. Louis region, because over in Illinois, that move that placement is different. So we're having those interesting conversations. But other than that, business as normal.
Thank you, Dale, for that update. And I would say that since St. Louis is the gateway to the west, that you close the gateway and not allow that eastward movement of hospitalization increases. We like our downward trend currently. So get on that, brother. Thank you so much.
Doing our best, man. Doing our best.
All right, over to Remert, Mike.
Yes, sir.
Any updates from Remert?
We're just moving forward with planning and helping assist where we're needed. Some of our guys have been helping here at the hospital with the vaccine clinic, but we're just working on planning and supporting wherever we're needed.
Indeed. And plug again for REMERT. Even if you are not we consider you guys our REMERT a specialized team for our region. This sounds like I'm close to a hospital. Yep. No, stop. Running out of here. Apologize. Our REMERT team continues to work in the background, doing lots of stuff. We've had some of our REMERT folks assisting with giving vaccines, which is great. And as Dale was talking about the 1A portion of EMS, we've got our folks that are involved in REMERT. While sometimes they may not be considered, you may not see them today as a healthcare provider. They're doing yeoman's work in this region, trying to support us at every beck and call. So thanks for Mike and keeping this all together through a crazy 2021. Lee and Eric done a great job as well. And I know Leanne is probably somewhere floating around out there. Maybe she's even on the call listening in, because I know it's probably still on her calendar. But they've done a great job. So again, I continue to plug REMERT. I ask that when you get opportunities to drive traffic towards REMERT, we have a great volunteer community, and in this space specifically in healthcare, we have a great community. But a lot of times you see the same faces all the time, and that gets tiring after a while. So if you know somebody who's sharp and wants to help and contribute, they don't have to be in St. Clair County. They could be anywhere. We definitely like to have them on REMERT. So please continue to plug the team. Thanks, Mike. Mental health, any updates? I don't know. I don't think Dana is on. I'm looking. No. Sue, any updates potentially?
No, I don't have an update.
Okay. Now, I do know, and I did have an email chat with Dana not too long ago. Those mental health lines that we did send out, I know I sent them out maybe a little bit before Christmas again, are still up and operational. So if you need that type of support, please continue to share that with your staff and with your community partners in healthcare. So we want to make sure that we are supporting all of our providers, across the spectrum. So please continue to support our mental health team. Okay, as far as grant status goes, so we'll talk about current grant. We're talking about the 20 to 21 grant. We do not have an executed grant yet. So if you're still waiting on your paperwork from Christina and all that, we're not there yet. Unfortunately, I mean, it's just time. Last thing I knew, we made through all the fiscal stuff. We did all that. We did receive it back. We have approved what we saw, and then it went back to IDPH and just waiting on the finalized executed grant so we can move to that next stage to get your contracts set. So please, thank you for what you have submitted, but please be patient. We're almost there. So, but once we do get that, it's a hurry up and wait. I rush you to hurry up and get the documentation done. Okay. Then you got to wait a long time. And then at the end of that, you're going to have to hurry up and spend whatever you do have. So just please be ready. I would have the documentation that for all of you who've had previous year's grant, the documentation that we're using is going to be fairly the same. So all of those monthly reimbursement requests, just remember you're going to have to submit those as well from June of last year all the way up through, and they'll say zeros on all of them. So you can go ahead and probably begin prepping those, or as soon as you get them from Christina, I just ask that you go ahead and prep those and get them back to her as soon as possible to have that zero balance on it until you get to spending, and then that way you're ahead of the power curve. With that said, you will all receive an invitation to a form to fill out for the 21 to 22 grant. So that will basically say, just like we do every year, hey, what are your needs? What project requests do you want to submit for? This past year, we had a lot of training and education. Again, that the COVID upset the apple cart there. So we obviously were unable to do those things. Don't forget about the training and education that you wanted before this, because maybe that's something that we can do in the next year going forward. So please be ready to knock that down. We did talk about the reallocation of funds. The one thing that I would ask is that, and I would like to open it up for some dialogue with regard to when I told you that we had $110,000 that we have to realign in the grant to purchase, and we want to purchase. When I say we, I just took it with the team that we have here, myself, Mike Gilbert, Lee, Eric, and Scott. We talked about ventilators. We know we have sunsetting ventilators, the Impacts Eagles 754s that are no longer supported via Zoll or Impact. And it's getting harder and harder to have those serviced and to find parts and pieces for them. So what we'd like to do is push those to the back and just go ahead and move forward with a product or a ventilator that would meet the needs that we have, that is both EMS friendly and can be used in a hospital setting. And we believe that to be the LTV 1200s. So I'm open. I would like to open up for some discussion for potential other uses of that $110,000. I don't want to do that unilaterally and just say we're going to do that. That's something that, anything, according to our bylaws, and I use air quotes when I say that, our governance doctrine, I'm not supposed to do anything more than like $5,000 without consent from the coalition. So I would like to get your guys' feedback on that, on potential other options that we could use that $110,000 for before I ask for it to be realigned in the budget. So I'm going to stop talking there, open it up to the floor for a little bit of discussion.
Hey, Phil.
Yes.
Okay, I do have one question because I'm communicating with one of our hospitals. Don't we have telemetry monitors in the region for loan out to hospitals?
Yes, we have a 12-bed set that is currently, if I'm not mistaken, Lee, still is over at St. E's, or did we not move it? We didn't move it, did we?
It's at Anderson.
It's at Anderson right now.
With
yes.
the field hospital.
Okay,
So,
then
yes.
we'll have that hospital make a request to you, correct? Is
Yep.
that how you would like it?
Of course, yep. Make sure they submit that through D4H as the resource request in D4H, and we will make it happen. Just let us know what the need is, and we can make it happen.
Okay, great. Thank you.
Mm-hmm. So again, I'd like to open up for a little bit of dialogue on thoughts on the 110,000, and would potentially just go ahead and vote on that today if we could. Are there any objections to doing it, to moving forward with the LTV 1200 ventilators, or do you think that there's other options to use that 110,000 that could be better served here in the region?
Hey,
Phil, this is Sam.
Chuck.
Oh, go ahead, John.
Nope, you go ahead.
Oh,
Sam.
I was just going to say that's good with us. I mean, clearly it's a need that we have in the region. So yeah, that's good with us.
John, okay, thanks, Sam. John, go ahead.
Okay, Phil, this is Chuck. What I was going to recommend is, I like the LTV 1200, and obviously I gave you one during that. There are some drawbacks to the LTV 1200. And that's why we at MedStar chose the Zoll Z vent, because it will do adult, pediatric ventilator in one box, as well as it can do CPAP and BiPAP and end-tidal CO2 all in one device. And the pricing is much cheaper than the LTV 1200 was, especially when you start looking at a bulk status.
Okay.
Because I just purchased 2 more of them from Zoll. That'll give us a total of 5.
Okay. any thoughts? I know my EMS brothers and sisters that are on the line, or any of the hospitals. Any thoughts? I know I'm not specifically familiar with that specific event, but I do know that you got them. So Mike or Eric or John.
Are you familiar with the EMV Plus that came out after the Eagle 754?
Yes, I am. Yes.
Okay. It is basically the upgraded version of that, so it could do BiPAP as well as, so it can be a standard BiPAP, CPAP, or an actual full-blown ventilator. It replaced the EMV Plus. So it would serve multiple uses, and they've already got it set up for in-hospital use and out-of-hospital use. So it would be best served to have something that's very easy to cross-train on, and they have all their training videos online for their products.
Okay, but ventilator, you still think that despite the brand, ventilator support and supplies, do you think that would be best suited for the 110,000?
Yeah, I think it would still be better suited for the 110,000, and because we've really struggled with ventilators this go around. I've lost a total of 5, I believe, because we weren't notified that the patient was COVID, and these have the capability of having filters where our old ones do not, and we are in the same boat. We can't buy parts for some of our ventilators. That's why we're trying to upgrade our fleet. But these give you the capability of filtering all gases, inhalation, exhalation, throughout the whole process. So I think if we're going to do it, think about God forbid, the next pandemic, whenever it may be, or the current situation, that we can run these filters and have the filtered air no matter what, in inhalation and exhalation gases. And battery power with or without oxygen or breathing air.
Okay, Chuck, thank you for that feedback. Any additional feedback from the coalition with regard to the 110,000? So right now it sounds like, we were thinking ventilators. While we did pick a specific one, Chuck is potentially offering a different version, but we're still in the same lane as far as ventilators are concerned. Any other thoughts on that 110,000? Anything outside of ventilator support do you think would be better served for that 110,000? And again, this is open to the coalition. So again, don't everybody jump in at once. George, I'm gonna pick on you. What do you think?
I think the ventilators is a good idea.
Okay.
Pick on somebody else now.
Sam jumped out the window first, so she got off the hook. Chuck jumped on. Okay, I put you in the fire. I'm gonna look at one other person from. I'm gonna pick. Oh yes, who was that? Go ahead.
Hey, this is Tina from Fayette County Hospital. I got on at the very beginning, but then I somehow disconnected myself. But I agree with the ventilators.
Okay, thank you, Tina. So outside of, so let's do this then. Okay.
This is Sue.
Oh, go ahead, Sue. Perfect. Thanks.
I had a suggestion. So whenever we were doing external triage and external treatment, testing and whatnot to decompress the ER initially, we used a Mavis tent, which had the HVAC system in that. That we looked at purchasing a tent after the fact, and they are kind of pricey, but not terribly pricey. I mean, $10,000, maybe $8,000 for the size that we had. Since then, we've rigged our HVAC system that we could connect to a tent if we ever did get one in that same area. But what about tents? you know, everybody is using some sort of makeshift tent right now just to get into the screeners sometimes. And if we ever would need to separate, you know, segregate and treat in street or test in street in an enclosed area, a tent might be a good purchase. I don't know. I know they're bulky and require storage, but it was a little cumbersome trying to get it from Mavis, coordinating the erection and tear down, and then storage of it elsewhere and pickup, and all of that was kind of, you know, not ideal. If everybody had their own tent or we had a place to go grab a tent, you know, centrally within our region, that would be kind of nice, and we wouldn't have to be tagging Mavis all the time.
Thank you, Sue. So with that, I would say I'm gonna toss it to Mike because I know he has he has the pulse of our tent availability between us, Remert, Mavis, and all that type of stuff. Mike, what are your thoughts on additional tentage?
Sorry, Phil, can you repeat that? I was in a conversation in the conference room.
It's okay, no problem, no problem. Sue was offering up, she said, as a potential, she says, you know, we went through the need for tents and external triage that we've done. And she's offering, she said, well, maybe that might be an opportunity for us to maybe reallocate those funds, that 110,000 that we're going to be using that we were planning to use for vents, or that we suggested to use for vents, that maybe we could squeeze some of those dollars into for that purpose, for the external triage. Can you talk a little bit about, I said, you know, outside of probably Lee, I think you probably have the most knowledge on the pulse of where we can grab tents at rapidly, and the cost of tents, and the tents that we need, and what we have on Remert, and what we recently purchased. As you know, do we think it'll be cost effective to buy that, or just continue to rely on whether it's the EMAs or Mavis to have a little more tent support within the coalition directly? So what are your thoughts?
The tents are expensive, and then the time it takes to make sure we have enough people trained that know how to set them up comes into a huge issue. Currently, every Mavis division has one tent with HVAC system and generator to run that HVAC system and the power to that tent. Remert has one, you know, the coalition has the 3 that we just bought last year. Special Services has 3, just like what we bought last year for the coalition for the field hospital. For the amount that they would actually get used, I think we're better off doing requests through Mavis, through EMA, and to get Mavis to bring those tents to us, because they also bring manpower to put them up.
Thank you, Mike. Anyone with any additional feedback or thoughts on the tents?
Hey, Phil, this is Rick. We were lucky enough, the city of Granite City had CARE dollars, and they purchased a 30 by 30 and a 20 by 20 event tents for us, and they are the hospital's property. We worked with a vendor, I think in your neck of the woods, and they are qualified and ready to assemble or disassemble at any point in time. So for that manpower factor, you know, notwithstanding a specific incident where they may or may not have arrived, it seems to be available.
Hey, Phil, this is Dan at Sparta, and I would have to agree with what Mike said. We had a Mavis tent here for probably 6 months through late spring and early fall, and it worked very well, and we had a very positive experience with Mavis. I mean, they were great in what they did and letting us have that thing for that long, and the tear down and the setup. So I kind of agree with what Mike said.
Thank you for that feedback. Okay. Any additional thoughts or alternatives for potentially for that 110,000? Okay, hearing none, I would like to kind of do this. I mean, it's very rare that we get an opportunity to do anything very formal with the coalition, but I do respect Sue's request, but I would like to put to the coalition. I would like to put to the coalition to put forth a vote on which direction we go, not on a specific product, but whether we go our ventilators or we go for down the aisle of ventilators or go down the aisle of tents, or potentially a hybrid. But at first I'd like to know just offhand which direction we'd like to go. So I think we need to put forward a vote to do so. Does anyone want to put forward a vote to determine which direction we go, tents or ventilators?
Phil, this is Sam. I vote for ventilators.
Okay, so Sam.
This is Gary. I second.
Okay, so Gary's second that. I will do it by abstention. Anyone opposed?
Hey, Phil, can I ask a question?
Sure.
So how many actual, so I'm not talking about Mavis and not talking about St. Clair County EMA, how many tents do we own as a region, and were any of those used through all of this?
So I'll let
'Cause
Mike.
I was a little confused.
No, I understand. I'll let Mike kind of answer that. Mike, do you want to touch that? The amount of tents that we actually use that we own, the total amount that we have. I mean, I will say a number, but I'll let Mike do it. Mike?
So the coalition owns 3 tents currently. We own 2 19 by 25s and we own a 20-foot round that are able to be interconnected if we're setting up a field hospital, but or it could be set up as 3 individual tents at different locations.
And we didn't use any of those, or we did use them?
We did not use any of those. We only used Mavis assets because it came down from IEMA.
Okay. I just wanted to be clear on that. Thank you.
Sure.
Yep.
I think it's important to mention, we don't have HVAC units for all those tents. We're dependent on other services for that.
That is a true statement.
We only have 2 HVAC systems that went to the 2 tents before. So while the 2 HVAC systems would work for if they were all interconnected, if they were not interconnected, 1 tent would be without an HVAC system.
So in turn, I will go back. I'll back up just a little bit. So we had a motion to go ventilators. Gary seconded it. I asked for basically all the nays first. And at that point, we just had a point of clarification from Greg. So I'll go back to the vote. Anyone opposed? Any nays for the ventilators? Okay, so we will move forward with the ventilators in the realignment of the budget. And we'll do a little more research with our partners, both MedStar and Abbott. Those are our 2 largest services that we have here, and just get a little more feedback and see which way we can do it, which way we can go forward the best to get the best bang for our buck. Because ventilators get expensive really quick. So, but we'll discuss that. Thank you again, Chuck, for the feedback.
You're welcome.
All right, we'll move on to COVID vaccine status updates. So lots has transpired over the course of the last couple of weeks. So I know a lot of the organization, all of the hospitals have been moving forward and probably done a lot of your folks. I don't know who's totally complete, but I'm sure you guys have got a lot of folks vaccinated, and that's a great thing. As Dale kind of pointed out, over here on the east side of the river in Illinois, we're obviously one of the first folks in the state of Illinois to even move forward with our EMS folks. So I'm super happy that we kind of led some of those efforts here. And I'm hoping that our partners on the west side of the river in St. Louis begin to move in that direction quickly, because we value you guys and a lot of times we see that some points you have a more at-risk mission, especially when you have a ventilated patient that you're going to travel with for 6 hours to get them up to Chicago or somewhere else. You can't get out of the back of that ambulance, and they're a vented patient, they're COVID positive. So we hope that each one of you guys, we don't lose another EMS crew to being sick from COVID. Just like we don't want any of our frontline nurses, PCTs, EVS personnel to get sick. So anyone out there 100% complete with all of their, when I say 100%, you went through all your vaccine, you don't have anybody else who wants to get vaccinated, and you're done. Who's out there that is done today? Anyone? I want to have a success story.
Well, Phil, this is Gary. We're close. I can't say 100% because I'm not sure, but we're getting there.
We're pretty much done here at Sparta. We're ready to keep rolling. We're antsy to get the population out there and get more vaccine, and we'll vaccine as many people as we can get vaccine for.
Outstanding.
This is Sue from Staunton. We're done. We vaccinated 102 people. We were at 67% of our staff, and we used up all 100 doses that were allotted to us.
Outstanding, Sue. Anyone else?
Phil, it's Tina, and we completed our Pfizer part, the Moderna that we have, because we have a long-term care facility attached to ours that there's a few employees that will be able to use that. Also on the hospital side, we did have a few that did have a reaction, and one that ended up being admitted. So I think for the most part, we're pretty good here. And then the county health department had their big drive last Saturday.
Very nice. On that staff member that was admitted, what was it primarily to? What was the? Go ahead.
Symptomology. It was ended up being chest pain, some nausea and vomiting right after the injection. I'd say within 5 minutes after.
Wow. Okay.
I don't have the exact time frame.
Has anyone else had any adverse reactions? I will say to that magnitude, where you had someone immediately have an adverse reaction that was that required to be admitted. Anyone else have a story similar? Okay. Well,
hey, Phil, it's Gary.
Go ahead, Gary.
I want to clarify. We did, all the doses we got from Moderna and Pfizer, we did use every dose. So I'm pretty sure we're there. I just didn't want to say 100%.
No, that's fine, Gary. No, I appreciate it. I just know that, even if let's say you had 1,000 or you had 50,000 doses, there's probably still a portion of those folks are just like, well, I'm just not going to get vaccinated. It's not mandatory. It's not going to cost me my job. I'll continue to wear a mask. So just was curious if we still had some more holdouts. I'll say
that's true. Yeah. Go ahead.
I would say here, being over the emergency preparedness department, it's traditional preparedness, EMS, and I have our hospital operators. I will say this, that starting off, I didn't think my hospital operators, their uptake on the vaccine was a lot slower than the EMS crews and the folks here that deal with patients day to day. But looks like over time, folks are becoming more accustomed to it. They've seen that folks haven't grown a third eye or the likes, outside of some of the, and again, I'll say rare cases that Tina kind of outlined, because for us, we haven't had a ton of adverse reactions at all either. So I think that's good. That's good for everybody. And I'm sure when the data all comes out, hopefully we'll see that, in the end that it was, whether Moderna or Pfizer, that it was obviously beneficial and we didn't lose a lot of staff to the vaccine, taking people out for days and maybe a week at a time. So that's great news. Are there any things that you guys would like to share as successes from your vaccine clinics or things that you realized over time. And I know when we discussed maybe a couple weeks ago at our last meeting, we discussed having pharmacies, farm techs, or whatever draw up medications and how that had helped reduce any of the drag of the nurse pulling the vaccine, drawing it up, et cetera, et cetera. So that's been a really big win for us. Has anybody else experienced any other wins that they would like to share as we go forward, still continue to vaccinate folks?
Phil, I still have to say I'm very proud that we were able to pull off what we did. And, we've already helped out Clinton County Health Department. We're scheduled to help St. Clair. We've been able to assist you at Memorial East for EMS. So I have to commend this whole group that helped get that off the ground, get it passed so we could keep our clinics moving and get it done timely.
Going a super thanks to all our EMS folks, and specifically you. Like I said last time, you, Chuck, and John and crew, been outstanding to work with. It's been a real blessing to have you guys do some of that labor so we can keep nurses on the front lines all the time. So it's been an extreme help. You guys are a force multiplier in that regard. And what I can say is that as we begin to move out and help our local health departments like Sam and Mila and crew here in St. Clair County, we're getting our, we're prepped to have our EMS students participate in the process as well. We're looking out to pharmacy students, all of that. We actually have pharmacy students that are here in Memorial working inside of our clinic. And again, I can't stress how much that's been, them drawing pre-filled for the nurses has been a real blessing, and has sped up the process. And I'm sure that's probably going to be integrated in a lot of the open, I don't want to say open pods, but some of our more community pods. We are going through the process now here in St. Clair County, and I won't say it, but I'll allow Sam an opportunity. I apologize, Sam. I don't want to speak for St. Clair County, but would you mind giving just kind of a look into our future with how we're starting to move forward here in St. Clair County, and maybe
Sure.
someone else could share? So
Absolutely.
Thanks, Sam.
So we are vaccinating our clinic staff and nurses this week. We are looking to start our actual appointments for those in 1A on Friday. And moving forward, we have been having some vaccination coordination calls for the pods that we are going to be doing as we get into 1B and into 1C. And obviously, a lot of that is going to depend on what happens in the coming weeks with the new president. I'm sure we've all heard that, there is a potential that there is going to be a very large push of vaccine out. One of our biggest problems, I would say, to date is that we do not have consistent dates, for vaccine delivery, if it's going to be once a week or twice a week, and the amount that we are allotted has fluctuated as well. So we are hoping to get on a more consistent delivery and order schedule, and obviously looking at increasing the amount of doses of vaccine that we receive. Because until we start receiving more vaccine, we can't vaccinate without the vaccine. So we need to start seeing some increased numbers for what we are allotted from the state. And we have the facility at 330 West Main, which is right next to the driver's license station in downtown Belleville. And that is going to be where one of our drive-through clinics is going to be. And we are in talks with both Memorial, St. E's, for helping us staff a secondary location for when we get to what we're going to call a super pod for getting through 1B and then 1C. So we are moving down that road right now. And as I said, again, a lot of this is going to depend on the allotments that we get from the state for the amount of doses that we receive. And this is somewhat kind of taking a little turn off of vaccine, but if there is anyone that is with a, an ambulance facility, we were able to get MedStar, and I'm working on getting Jeremy's. If anyone is interested in getting Binax to test with, please let me know. We can, go through the process with you for what is required of you as a facility, and then we're able to provide you with Binax so you guys can do any rapid testing you need to on your staff to help keep your staff in-house and working to continue your operations. If anybody needs my email address, please feel free to reach out to Phil and then reach out to me. And if anybody has any questions.
Thank you so much, Sam. Any questions for Sam? Okay, I would like to give some of our other health departments an opportunity to kind of discuss where they're at if they would like to, with regard to the 1A to 1B transition and what the kind of future kind of looks like in your county. So this would be an open opportunity. Don't everybody shout it at once, but if you would like to discuss that here, this is an opportunity for you guys to do that and share it with the hospitals and some of your EMS partners.
This is Tiffany with Eastside.
Hey, Tiffany.
Hey, so I think by Friday we'll have all of our staff and pretty much all of our 1A complete, and looking forward to moving on to 1B by the end of next week, probably.
Thank you so much. Thank you so much, Tiffany. Anyone else?
This is Heidi from Jersey.
Uh-oh. Okay, go ahead. That sounds like some old Nintendo music. Go ahead, Heidi.
So Jersey's kind of in the same boat. We hope to be done with 1A by the end of this week. And we've already started overlapping into 1B. We've got a lot of our first responders already done. So we just got to do those that weren't available to come to the first clinic. So we hope to be completely into phase 1B by next week.
Great. And are you guys doing that in the hospital settings, or you guys have a separate pod, or at the health department itself? How are you guys doing
Yeah,
that?
we have a separate pod. So the hospital's taking care of all of their staff. And then we're doing everybody, all the healthcare workers that are not affiliated with a hospital, that either work in our county or live in our county, or, I mean, we've just done anybody that's reached out to us that's a healthcare provider.
Great to hear. Thank you so much for sharing.
Mm-hmm.
All right, we have time for one more. If someone else would like to share from one of the health departments. Okay, I gave a good 5 Mississippi. So, okay, so we keep moving forward. There's a lot of folks between, I'm always looking at the numbers, between here, I think we're around, Sam, correct me if I'm wrong, we're somewhere around 260,000 here in St. Clair County. Madison County's just right around there, a little bit more, to be quite honest. And when we move out to some of our rural counties, I'm just always curious as to how that information gets presented and how you share that information sometimes, and where's the uptake of that information occurring. I know are you guys using websites, or are you guys, what local sources are you using to get that information out, and what it's going to look like in 1C? We don't have to answer that now, but I'm just super curious as to how that looks, and maybe next month we can discuss that a little bit more. So, all right, let's see. We'll move forward. I think we are almost there. D4H resource request. And when Greg was talking earlier about someone wanting to use the telemetry set from Anderson, again, as a reminder, send your resource request through D4H. Jump in the appropriate buckets. You want to make sure that if you're a hospital, get in the hospital group and submit your resource request. For your EMS agency, do it in the EMS portion, or local health departments, etc. Please submit those. Make sure you tag Lee and myself, so we will be notified when you submit that. And it's nothing wrong with just shooting us an email after you're done, just to make sure. Just say, hey, I submitted a resource request to D4H. Please take a look at it. We will take a review, contact you, and we'll work out the details. So, Lee, I don't know if we have any outstanding resource requests. Is there anything out there right now that we need any clarification on?
I don't believe at the moment that there is, no.
Okay. Okay, perfect. All right.
On that note, Phil, we do still have folks, face shields, vinyl gloves. We have gowns, we have surgical masks. We have a small cache still of N95s, face shields, if I didn't say that already. Lots of face shields, lots and lots of face shields. That's probably the thing we're the heaviest on is face shields right now. So, I mean, if you need supplies, please do put the request in. We'll set up a time for you to pick it up, and, it is available.
Thank you so much, Lee. Okay, we'll move on to just open floor. We're going to open the floor up. Questions, concerns, things you'd like to bring to the table for the coalition.
Phil, it's Lee again. Can we briefly hit on the EM resource? Because we've had several calls recently from state regarding missing reports or reports where the numbers didn't quite jive.
Yeah, data fields. Okay, yeah. Dan Lee is becoming, more my friend. I get I get contacted from him at least twice a week. And this is not the normal daily submission where, we've discussed it ad nauseum in the past where maybe your surge number or your capacity number is less than your current number. Not the daily emails and some of the things that I send out to you guys. We're talking about misplaced numbers or just purely not updating. Now we don't have a lot of folks that fall into that boat, but we do have a few organizations that we are constantly contacting to correct data. So I'm asking, please, whomever you have as your point of contact that is in EM resource that should be contacted, please make sure their information is up to date. And please just talk with them about making sure that their information is accurate. Okay. The state looks at these numbers every day, and I don't know how Dan Lee sleeps, to be honest. I hope he has a team of folks that works with him because he's going through, because I know he's definitely in Region 4 / the Edwardsville region constantly. So please make sure that data is as accurate as you can make it, and please make sure that it's timely. They have relieved the requirement to do twice a day updates. Still want that one before 10, but it does us no good if the information is incorrect. A lot of times, and we just had this here at Shiloh, here at Memorial. So I'm talking to myself as well as when I'm talking to you guys. I have to reach out several times over the past couple of weeks, and I do believe it's just fatigue. Folks are getting a little fatigued and maybe not looking and focusing. So we just got to get refocused on that and make sure that data is as accurate as possible. Any questions or concerns on EM resource? Okay. Again, floor is open. Questions, concerns? Okay. Well, we are at the end of the line here today. That's great. We're just over an hour together. Our next meeting is next month on Wednesday. On the first Wednesday of the month. I'm trying to pull up my calendar, but I can't pull it up because I have my screen covered. But we will not have an afternoon hospital meeting today. So that will be canceled off of your calendar. So please do not attend or please don't send an email saying, hey, what about the 1 o'clock? What about the 1 o'clock? We are not having that today, just the 10 a.m. And sorry, we had to reschedule it from last week. So thank you guys for all attending. If you need anything, please feel free to reach out. Don't hesitate. We'll try to help you as best we can. And till next time, we will see you in about 30 days or so, or a little less than 30 days, maybe 2.5, 3 weeks. So take care.
Thanks, Phil. Have a good one.
You too. Bye, everybody.
Bye, everyone.
Bye.
Bye.
Bye, thank you.